Hi everyone, my name is Kailyn Brooke. I'm 21 years old and I created this channel to help spread awareness of chronic illness. This is my first video in which I'm going to be defining these chronic illnesses, talking about their symptoms, and various treatments. One of the chronic illnesses that I have is gastroparesis. Gastroparesis is sometimes abbreviated as GP. Gastroparesis is a motility disorder which results in delayed emptying of foods and liquids from your stomach to your intestines. Gastro means relating to the stomach, and paresis means paralyzed, hence gastroparesis. In gastroparesis, your stomach can be partially paralyzed or completely paralyzed and not be able to get food into your intestines. This paralysis is due to damage to the vagus nerve. When the vagus nerve is operating normally, it's able to send signals to your stomach muscles to tell them to contract and to help move food from your stomach into your small intestines. Of course, there are varying degrees and severities of gastroparesis. They can range from being considered grade 1, which is having some food intolerances, which can be fixed by changing your diet, to grade 3, which is very severe, and you have a lot of trouble keeping your food down, and you need a lot of medical help in order to get the nutrients that you need. But when the vagus nerve is damaged, food tends to sit in your stomach longer than it's supposed to, which leads to various consequences. Other symptoms of gastroparesis include nausea and or vomiting, abdominal pain, acid reflux, bloating, weight gain or loss, and early satiety. I'm not sure if I said that right, but that basically means when you get full very quickly, only after a few bites of food or a few sips of your drink. Another thing that can result from gastroparesis is loss of appetite. And it's normal for people with gastroparesis to develop a fear or avoidance of eating, because obviously all these symptoms are not fun. I know I went through a period where I was afraid to eat because of all of these symptoms that I was feeling. This was a time when I was just living off of ramen and the little saltine crackers. I tried to avoid eating as much as possible so I could just prevent all the bloating and the nausea and pain that I was feeling. But when I didn't eat, my acid reflux got much worse, so there was nothing I could really do, but I had to try to get food in me so that I could get the nutrients that my body needed. There's not always a clear reason or cause to why gastroparesis occurs. Many of the causes of gastroparesis are idiopathic, which means that they have no cause or an unknown cause. One of the contributors of gastroparesis could be diabetes if you have that, and gastroparesis can make managing diabetes very difficult because you have to maintain a certain blood sugar, and it's very hard to control that when your body is digesting and processing foods at different rates. Something else that can possibly contribute to gastroparesis is Ehlers-Danlos Syndrome, or EDS, which I also have, and I will be making another video talking about that genetic disorder. Gastroparesis can be diagnosed in a variety of ways, including a breath test, a wireless capsule, or by a gastric emptying test. The gastric emptying test is the most common test that's used to diagnose gastroparesis, and that's what was used for me to diagnose my gastroparesis. So basically, you eat a little breakfast that they make you with some toast and some eggs that have a harmless amount of radioactive tracer. And over the course of 4 hours, they use an x-ray to measure the rate at which your stomach is emptying. And after 4 hours, if a certain percentage of food is still remaining in your stomach, then you are diagnosed with gastroparesis. I forgot this exact percentage, so I looked it up on aboutgastroparesis.org, and if you have 10% or more of your meal still remaining in your stomach after the period of 4 hours, then you have gastroparesis. Some complications of gastroparesis include starvation, dehydration, malnourishment, poor control of blood sugar, which I discussed earlier, often getting a phobia of eating due to all of the pain that you experience from the symptoms, interference with everyday life, or overgrowth of bacteria or fungus, SIBO or SIFO, which can occur in your intestines when food does not move as much as it should. I'm probably butchering this too, but another complication can be a bezoar, which is a hard ball of undigested food that can sit at the bottom of your stomach. It causes nausea and vomiting, and it can be life-threatening if it ends up blocking the entrance to the small intestine and will need to be removed. To avoid this complication, it's important to avoid foods that have a lot of fiber in it and that can form these bezoars. Unfortunately, there is no cure for gastroparesis right now. However, there are many ways to treat it and to help manage it. These treatments or changes include changes in lifestyle and diet. Medications used to help manage gastroparesis include anti-nausea, anti-acid, antihistamine, and more. Some procedures include dilation of the pyloric valve, which is the valve that connects your stomach to your intestines, and to open that up just so food can pass to your intestines more quickly. I personally have had this done 2 times already, and my doctors have advised me that it usually doesn't work more than 3 times, so hopefully everything will be fine and continue the way it is right now for a while, but I don't know. Another procedure includes implanting a neurotransmitter into your stomach so that it can send electrical stimulation for your stomach to contract when your vagus nerve is not able to tell your stomach to do so. In more extreme cases of gastroparesis, feeding tubes can be used in order to help patients get the nutrients that they need. I'm going to add some links to some great sources that you all can feel free to learn more from. For now, that's it. Thank you for watching, and I hope you all are doing well.